Hi, I am Leslie Rickey, and I'm an associate professor in the departments of urology and obstetrics and gynecology at Yale University, and I am also the FPMRS fellowship director there. So my question today is how I advise patients on post-operative activity restrictions. So when I was thinking about this, I had to back up a little bit and just think about why do we even have activity restrictions for our patients, and I think it's because that we think that their level of activity will somehow negatively impact our surgical outcomes, particularly with regards to the reconstructive nature of our surgeries. However, I will say there is very little evidence to support this philosophy or guide any recommendations in this area, which is why we see a pretty wide variety of how people talk to their patients about this. Before I get into what I do, I did just want to bring up some of the heterogeneity in provider practices. There was an SGS survey carried out last year that showed that while about 80% at least of providers do recommend restrictions, the amount of weight that they, the lifting restrictions, the activity restrictions, how long, how much, had pretty wide variation. It interestingly also showed that people that had been in practice for longer tended to be a little more lenient with their activity restrictions, and I actually have found that this reflects how my practice has evolved. Also, when I first got out, I tended to be quite strict and prescriptive in my recommendations, and as I've gotten further out and I think recognize that there's probably not a single acute early event that the patients do that causes a failure in our surgeries has caused me to back off a little bit and let patients sort of live their lives. That being said, I still do tend to recommend that women after a prolapse, the majority are going to be prolapse or incontinence procedures, but after any of these pelvic floor procedures that I do recommend no strenuous activity for the first 2 weeks. I still use this 10-pound guide, which I don't really know where it comes from. It's what I was taught, or I guess what I saw modeled when I was in fellowship, and in that SGS survey that I referenced, the kind of average, the vast majority of people recommended some lifting restriction between 5 and 15 pounds. The other thing, though, that I've started talking to my patients about is I think we recognize from some other measures of intra-abdominal pressures and what different activities cause those pressures, that one, some things that patients can't avoid doing, like coughing or sneezing or changing position, tends to generate just as much activity as some of the things we tell them not to do, like lifting certain amounts. So as I tell my patients, I said, this is all kind of made up, but this is what I do. And I think we've also seen in some studies that patients don't necessarily adhere to our recommendations anyway necessarily, although there are those few that get out to 6 weeks that still aren't lifting anything because they thought that's what they were supposed to do, and I don't think that is necessarily desired either. But I have also talked to them about how they lift. Some of those studies did show that you do generate greater pressures when you're lifting from the floor versus from a countertop. So for women that have young children at home, I say, the best that you can, try to, like, lifting from a high chair, probably okay. Trying to heave up one of those kids from the floor is going to generate more pressure, and you might want to avoid that if you can. I think there's also a difference in the procedures that we do and the amount of dissection and healing. So I have a little bit less restrictive recommendations after a sling procedure versus, say, a vaginal hysterectomy with uterosacral ligament suspension or sacrospinous. So I tend to also have people return to work at more sedentary jobs after a sling, after about a week. Some people might need a little bit longer, and also some women are sitting at desks and other ones are taking care of their grandkids, and then other ones are doing heavy manual labor, so I think that's important to take into account also. However, I find that even in women that are doing heavy lifting or manual labor after a sling, feel pretty comfortable going back after a few weeks. I looked at the IUGA and the AUGS websites, and after some of our larger hysterectomy and prolapse procedures, the recommendations on those sites I think vary somewhere between 4 and 8 weeks. For the most part, I still recommend 4 weeks to people. I find that actually fatigue is a more of a limiting factor maybe than what they're physically able to like lift or do. So, and again, it depends on whether they have a sedentary job or a more manual labor job. But I do still probably recommend about 4 weeks for most of them. Although I find some people ahead of the bell curve, they're ready to go back to their jobs where they're pretty active at 2 weeks, and other people at 6 weeks every now and then are still feeling a little tired. So I guess in summary, I've started saying after 2 weeks, do what you feel like doing. Let your body sort of tell you if something hurts, stop. If you're tired, stop. Don't overwork yourself. I think that can affect healing, but otherwise I let them just start to resume the activities as they feel comfortable.